2 years of gap between 2019 and 2021. No publications. No verifiable references. And you expect me to believe you were doing humanitarian work? Dr. Richard Brennan's voice cut through the conference room at Walter Reed National Military Medical Center like surgical steel through tissue. The morning sun filtered through the blinds, casting lines across the mahogany table where 5 members of the hiring committee sat reviewing a file that was, by all accounts, inadequate. At the far end of the room, Dr. Elena Volkov stood with her hands clasped behind her back, shoulders square, chin level. Her dark brown hair was pulled into a tight low bun, not a strand out of place. She wore navy blue scrubs that were crisp and spotless, though it was only 7:15 in the morning on a Monday. The temporary ID badge clipped to her collar read, "Contractor" in red letters. "Medical work in conflict zones, Dr. Brennan," she replied. Her voice was steady, controlled. Some organizations don't publish names for security reasons. Brennan leaned forward, his perfectly groomed gray hair catching the light. His white coat was pressed to perfection. The embroidered title Director of Cardiothoracic Surgery displayed prominently beneath the Walter Reed insignia. He adjusted his reading glasses and scanned the single-page resume again, as if hoping new information would materialize. Conflict zones. He repeated the word slowly, letting skepticism drip from each syllable. Which organizations? I'm not at liberty to discuss specifics. Elena's amber eyes didn't waver from his. Confidentiality agreements are still in effect. How convenient. Across the table, Dr. Jennifer Park, a 31-year-old senior resident with sharp eyes and sharper instincts, watched the exchange with growing curiosity. Something about the way the new contractor stood, the way she held herself, didn't match the incomplete resume. Park's gaze drifted to Elena's right forearm, where the edge of a tattoo peeked out from beneath her sleeve. Numbers. Coordinates, maybe? Dr. Volkov, another committee member, interjected, trying to ease the tension. Your medical school credentials are excellent. Johns Hopkins, top of your class. Your surgical residency at Massachusetts General was exemplary. But this gap, it raises questions about continuity of practice. I maintained my skills throughout that period, Elena said simply. I performed surgeries regularly, complex trauma cases, without supervision, without documentation. Brennan's tone grew sharper. That's not how medicine works, doctor. We have protocols, standards, accountability. I understand your concerns. Do you? Because from where I'm sitting, you look like someone who walked away from medicine for 2 years and now expects us to hand you a scalpel and trust you with lives. Elena's jaw tightened almost imperceptibly. The only sign she'd registered the insult. I'm here because you have a deficit of trauma surgeons. I can fill that gap. My hands are steady. My judgment is sound. Give me the simplest cases if you doubt me. I'll prove my competence. Brennan sat back, arms crossed. The other committee members exchanged glances. Walter Reed was indeed short-staffed. 3 senior surgeons had retired in the past 4 months, and the hospital was drowning in military and civilian trauma cases that required immediate attention. Fine, Brennan said finally. Temporary contract. Probationary period of 90 days. You'll handle routine cases only. Appendectomies, hernias, gallbladders. Nothing critical, nothing complex. And you'll be supervised at every step. Understood. And that, Brennan gestured vaguely toward her arm, whatever that ridiculous tattoo is, keep it covered. This is a professional medical facility, not a shopping mall. Elena glanced down at the numbers barely visible beneath her sleeve. 36 degrees, 12 minutes, 23 seconds north. 37 degrees, 9 minutes, 47 seconds east. Coordinates burned into her skin 3 days after she'd left the uniform behind. Aleppo. A city she'd never forget. A place where she'd learned that protocol meant nothing when lives hung in the balance. Something like that, she replied softly. Dr. Park watched Elena's face as she said it. There was no anger there. No defensiveness. Just a calm, almost detached acceptance. But Park had been studying people long enough to recognize when someone was carrying weight they refused to share. And this woman, whoever she really was, carried mountains. The meeting adjourned. Elena was handed a packet of orientation materials, a locker assignment, and a schedule. Her first case was set for 9 that morning. A routine inguinal hernia repair on a 45-year-old civilian patient. Nothing complicated. Nothing that required the kind of expertise she'd spent 6 years developing in places the committee would never know about. As the others filed out, Park lingered near the door. "Those coordinates," she said quietly, nodding toward Elena's arm. "That's Aleppo, isn't it?" Elena paused, her hand on the door frame. She turned slightly, meeting Park's eyes. "Just a reminder," she said. "Of what?" "Of where I learned that giving up is never an option." Before Park could respond, Elena walked out into the corridor, her movements precise and economical, like someone who'd trained to conserve energy for when it mattered most. Down the hall, near the surgical prep area, a veteran nurse named Jake was restocking supply carts. He was 62, ex-Army, 20 years as a combat medic before transitioning to civilian nursing. He glanced up as Elena passed, and something about her posture made him stop. The way she moved, the way her eyes scanned the environment, cataloging exits, equipment locations, potential hazards. He'd seen that walk before, in field hospitals, in forward operating bases, in places where doctors operated under fire and made decisions that would haunt them forever. He didn't say anything, just watched her disappear around the corner toward the locker rooms. If you want to see how this temporary contractor is about to leave the director of surgery speechless, make sure you subscribe to Emergency Heroes Stories. Drop a comment and tell us where you're watching from, because what she does in the next few hours is going to prove that some skills can't be measured by a resume. And some hands were made for more than routine procedures. Elena reached her assigned locker, number 147 in the surgical staff changing area. She entered the combination, pulled out a fresh pair of sterile gloves, and checked the surgical board mounted on the wall. Or 3. 9 o'clock. Hernia repair. Patient name: David Morrison. Age 45. No complications noted. Simple. Straightforward. Exactly the kind of case designed to test whether someone forgotten how to hold a scalpel. She allowed herself the smallest hint of a smile. They had no idea who they'd just hired, and she intended to keep it that way. For now, the residence lounge at 8:20 on a Monday morning smelled like burnt coffee and exhaustion. Dr. Jennifer Park sat in one of the worn chairs near the window, scrolling through patient charts on her tablet while 3 other residents clustered around the coffee machine, their voices low but animated. "So what's the deal with the new contractor?" a second-year resident named Marcus Chen asked, pouring his 3rd cup of the morning. "The one Brennan just grilled in the committee meeting?" 2-year gap in her resume, another resident, Amanda Foster, replied. No explanation, just says she was doing humanitarian work in conflict zones. Marcus snorted. That's code for either she lost her medical license or she was in rehab. Park looked up from her tablet, frowning. "You don't know that." "Come on, Park." Amanda leaned against the counter, arms crossed. Nobody just disappears from medicine for 2 years and comes back like nothing happened. Especially not someone who graduated top of her class from Hopkins. Maybe she had personal reasons, Park said. Or maybe she couldn't handle the pressure and burned out, Marcus added. It happens. Park thought about the coordinates tattooed on Elena's forearm, about the way she'd stood in that conference room, absorbing Brennan's condescension without flinching. That wasn't the posture of someone who'd burned out. That was the stance of someone who'd learned to endure far worse than bureaucratic skepticism. "I saw her suture work yesterday," Park said quietly. She'd been observing when Elena had closed a minor laceration on a patient in the ER during her orientation shift. The technique was different, precise, almost military in its efficiency. "Lucky guess," Marcus said. "She probably stayed up all night watching surgical videos on YouTube. Nobody learns to suture like that from videos." Before Marcus could respond, the lounge door opened, and Elena walked in. The conversation died instantly. She moved to her assigned locker without acknowledging the others, retrieved a surgical cap, and began pulling her hair back with practiced efficiency. The residents watched in uncomfortable silence. Elena secured the cap, checked her watch, and finally turned toward the group. Her amber eyes were calm, unreadable. "Morning," she said simply. "Morning," Park replied. The others just nodded. Elena walked out, leaving the door to swing shut behind her. Marcus waited until her footsteps faded down the corridor. "Okay," That was weird. What was weird? Park asked. The way she moves. Like she's on a military base or something. Did you see how she scanned the room when she came in? You're reading too much into it. Am I? Because I'm telling you, something about her doesn't add up. Park didn't argue. Because deep down she agreed. But unlike Marcus, her curiosity wasn't rooted in suspicion. It was rooted in recognition. She'd worked with enough trauma surgeons to know that the best ones carried scars the public never saw. And Elena Volkov's scars, whatever they were, ran deep. By 9 o'clock, or 3 was prepped and ready. David Morrison, the 45-year-old patient scheduled for inguinal hernia repair, was already under anesthesia. The anesthesiologist, Dr. Ramon Gutierrez, monitored the vitals, while the scrub nurse, Linda Hayes, arranged instruments on the sterile field. Elena stood at the sink outside the OR, scrubbing her hands with methodical precision. 3 minutes. Nails, fingers, palms, wrists, forearms. The same routine she'd performed hundreds of times in field hospitals, where water was a luxury and time was a countdown to the next casualty. Through the glass window, she could see Dr. Brennan entering the OR. He wasn't scheduled to supervise this case, but apparently he'd decided to observe personally, making sure the contractor didn't embarrass his department. Elena dried her hands, backed through the OR doors, and allowed Linda to glove her. Dr. Volkov, Brennan said from his position near the wall, arms crossed. This is a straightforward inguinal hernia repair. Textbook procedure. I trust you remember the basics. Yes, doctor. Good. Proceed. Elena approached the table. David Morrison was draped and prepped, the surgical site marked and sterilized. She accepted the scalpel from Linda, feeling the familiar weight of the instrument in her hand. Scalpel. She made the initial incision with a single smooth motion. Clean. Controlled. No hesitation. Brennan watched silently, his expression neutral. Elena continued, dissecting through layers of tissue with practiced efficiency. Within minutes, she'd exposed the hernia sac and begun isolating it from surrounding structures. Retractor. Linda handed it over. Elena positioned it carefully, providing optimal visualization of the surgical field. Then she paused. Her eyes narrowed slightly as she examined the exposed tissue. The color was wrong. Subtle, but wrong. The intestine visible through the hernia defect showed early signs of discoloration. Mottled patches of dusky purple against healthy pink. Dr. Brennan. What is it? The bowel. Look at the pattern of discoloration. Brennan moved closer, peering into the surgical field. It's within normal range for tissue under tension from the hernia. No, Elena said quietly. This is ischemia. Early stage, but progressing. See the distribution? It's not consistent with mechanical compression from the hernia alone. The preoperative scans were normal, Brennan said, his tone edging toward irritation. Vitals are stable. There's no indication of vascular compromise. Scans don't always catch mesenteric emboli, especially if they're small and distal. Elena pointed with a forceps. The pattern here suggests reduced arterial flow to the superior mesenteric distribution. You're seeing things that aren't there, Dr. Volkov. Elena straightened slightly, meeting his eyes over her surgical mask. With respect, doctor, I've seen this pattern before. If we don't investigate further, this patient could develop full bowel necrosis within 6 to 8 hours post-op. Based on what? Your intuition? Based on visual assessment and clinical experience. The OR fell silent. Linda glanced between them. Dr. Gutierrez checked his monitors, confirming that vitals remained stable. No tachycardia, no hypotension, no fever. Nothing that screamed emergency. Brennan studied the surgical field again, clearly torn between protocol and the nagging possibility that she might be right. Fine, he said finally. We'll get an intraoperative Doppler ultrasound. But if this turns out to be a waste of time and resources, you'll be answering some very uncomfortable questions. Understood. Linda left to retrieve the ultrasound equipment. The minutes stretched. Elena stood perfectly still, her hands resting lightly on the edge of the surgical drape, her breathing slow and even. Brennan watched her. Where did you say you worked during those 2 years? I didn't. Conflict zones, you said. Which ones? Syria, Iraq, Afghanistan. Brief rotations. With which organizations? Doctors Without Borders, International Medical Corps, others. And they taught you to diagnose mesenteric ischemia from subtle color changes? They taught me to trust my eyes when equipment isn't available. Brennan's jaw tightened. But before he could respond, Linda returned with the Doppler unit. Elena accepted the probe, applied gel, and carefully positioned it over the exposed section of intestine. The screen flickered to life, displaying waveforms and flow measurements. The room went quiet as the data populated. Reduced arterial flow, Elena said, her voice even. 50% decrease in the superior mesenteric artery. There's a partial thrombus. Brennan leaned in, staring at the screen. His face went pale. How did you see that? Elena didn't answer. She was already refocusing. Dr. Brennan, we need to extend this procedure. I'll need access to the mesenteric vessels. This isn't a simple hernia repair anymore. Brennan hesitated, then nodded slowly. Proceed. I'll assist. I need to extend the incision, Elena said, her voice calm but absolute. We're converting to an exploratory laparotomy with mesenteric vessel access. Brennan stepped closer to the table, his earlier skepticism replaced by focused attention. Agreed. What do you need? Scalpel number 10, larger retractors, and prepare vascular clamps in case we need proximal control. Linda moved with practiced efficiency, adjusting the instrument tray. Doctor. Gutierrez increased monitoring frequency, calling out vitals every 30 seconds. Heart rate steady at 72, blood pressure 120/75, oxygen saturation 98%. Elena extended the incision with smooth, deliberate strokes. No wasted movement. No hesitation. Her hands moved as though they'd performed this exact procedure 1,000 times, in 1,000 different circumstances, under conditions these surgeons couldn't begin to imagine. Entering peritoneal cavity, she announced. Large Richardson retractor. Brennan positioned himself across from her, assisting with retraction as Elena exposed the abdominal contents. The small intestine glistened under the surgical lights, and now that they had better visualization, the ischemic changes were more apparent. Patches of dusky discoloration spread across several loops of bowel. Jesus, Linda whispered. Elena's eyes never left the surgical field. I need to identify the superior mesenteric artery, mobilizing the transverse colon. Her fingers worked with precision that bordered on artistry. She lifted the colon, exposing the retroperitoneum beneath. Within seconds, she'd located the root of the mesentery and began careful dissection. There, she said softly. SMA. Pulsations are weak and irregular. Brennan leaned in, observing. I see it. There's definitely reduced flow. Fogarty catheter. Size 3. And heparinized saline. Linda retrieved the catheter while Elena continued dissecting, creating enough space to safely access the vessel. She worked in silence, her breathing steady, her movements economical. Every motion served a purpose. Every decision was instantaneous but appeared calculated. Up in the observation gallery, Dr. Park had arrived with Marcus Chen and Amanda Foster. They pressed against the glass, watching the procedure unfold on the monitors that displayed the surgical field. What is she doing? Marcus asked. Embolectomy, Park said quietly. She's removing a clot from the mesenteric artery. During a hernia repair, she found ischemic bowel, caught it before it became necrotic. How did she even see that? Amanda leaned closer to the screen. The pre-op imaging was completely normal. Park didn't answer. She was too focused on Elena's hands, the way they moved. Confident, precise, like a concert pianist playing a piece from memory. Down in the OR, Elena had isolated a section of the superior mesenteric artery between vascular clamps. Small pot scissors, she said. Linda handed them over. Elena made a tiny arteriotomy, just large enough to introduce the Fogarty catheter. She advanced it carefully, feeling for resistance. Passing the catheter distally. 20 centimeters. 25. There. Resistance. That's the embolus, Brennan confirmed. Elena inflated the balloon at the tip of the catheter with saline, then slowly withdrew it. The room held its collective breath as dark red thrombus material emerged from the arteriotomy, followed by a healthy flow of bright red blood. "Got it," Elena said. She deflated the balloon and passed the catheter again, ensuring no residual clot remained. Second pass. Clean. Flow restored. She repeated the process proximally, then carefully sutured the arteriotomy closed with interrupted stitches using 6-0 proline suture. Each stitch was perfectly placed. Equal spacing. Equal tension. The kind of vascular repair that took years to master. Brennan watched, transfixed. "Those are military-style interrupted sutures," he said, almost to himself. Elena didn't respond. She removed the vascular clamps and observed as blood flow returned to the affected intestinal segments. Within moments, the dusky discoloration began to fade, replaced by healthy pink tissue. "Perfusion restored," Dr. Gutierrez announced. "Bowel is pinking up nicely." Linda stared at the surgical field, then at Elena. "How long have you been doing vascular surgery?" "Long enough." "That was incredible," Linda said. "I've been in ORs for 15 years and I've never seen anyone work that fast." Speed matters when tissue is dying. Elena inspected the intestines carefully, checking for any remaining areas of compromise. Everything looked viable. No necrosis. No perforation. The patient would recover fully, completely unaware that he'd been hours away from life-threatening complications. She turned her attention back to the original hernia, which now seemed almost trivial by comparison. The repair took another 20 minutes. Mesh placement, secure fixation, layered closure, textbook execution. When she placed the final subcuticular stitch, Brennan checked his watch. 53 minutes. Start to finish. Elena stripped off her gloves. "The patient is stable and ready for recovery. Prognosis is excellent. I'll write postoperative orders for anticoagulation and monitoring." She turned to leave, but Brennan's voice stopped her. "Dr. Volkov." She looked back. That was remarkable work. His tone had changed. No condescension. No doubt. Just professional respect earned through undeniable competence. "Where did you learn to perform vascular repairs like that?" "Training," Elena said simply. "What kind of training?" "The kind you get when you don't have the luxury of time or perfect conditions." Before he could press further, she walked out of the OR, leaving Brennan standing beside the surgical table, staring after her with an expression that mixed confusion, admiration, and the uncomfortable realization that he'd drastically underestimated the woman with the gap in her resume. In the observation gallery, Marcus turned to Park, his earlier smugness completely gone. "Okay, I was wrong. She's not some burnout who couldn't handle the pressure." "No," Park agreed. "She's something else entirely." "But what?" Park watched as Elena disappeared down the corridor through the gallery window. "I don't know yet, but I'm going to find out." Down in the surgical lounge, Jake, the veteran nurse, was restocking supply cabinets when Elena walked past. He caught a glimpse of her forearm as she reached for a tablet to enter post-op notes. The coordinates. He'd seen markings like that before. Coordinates tattooed by military personnel to commemorate significant locations. Places that changed them. He didn't approach. Didn't ask questions. Some stories were meant to stay buried until the people carrying them decided it was time to speak. But he made a mental note to keep watching, because instinct told him that Dr. Elena Volkov's story was far from over. And whatever was coming next, it was going to be significant. Elena finished entering her notes, then pulled out her phone. She had 3 hours until her next scheduled case. Time to review patient charts. Time to prepare. Time to remind herself why she'd walked away from the uniform and into this world of bureaucracy and skepticism. She'd wanted quiet. She'd wanted routine. She'd wanted to save lives without the weight of classified missions and impossible choices. But as she looked at the surgical board and saw the list of incoming trauma cases, she realized something fundamental. There was no such thing as routine. Not for her. Not anymore. Some skills couldn't be unlearned. Some instincts couldn't be suppressed. And some hands were made for more than simple procedures. Whether Walter Reed was ready for that truth or not. The afternoon had settled into a rhythm of routine consultations and post-operative rounds when the speakers throughout Walter Reed crackled to life at 2:37. Trauma alert. Multiple GSWs inbound. ETA 4 minutes. Military personnel from training accident at Quantico. All available surgical staff to Trauma Bay immediately. Elena was reviewing labs in the resident workroom when the announcement echoed through the corridors. Around her, doctors and nurses dropped what they were doing and moved with practiced urgency toward the emergency department. She closed her tablet and followed, her heart rate unchanged, her breathing steady. She'd heard variations of that announcement hundreds of times before. In tents, in bunkers, in mobile surgical units where the walls shook from nearby explosions. This was just another day. The trauma bay erupted into controlled chaos. Nurses prepped multiple bays simultaneously. Surgical residents pulled on trauma gowns. Dr. Brennan arrived, already gloved, barking orders to organize the incoming casualties by severity. Through the glass doors, Elena could see the helicopter settling onto the rooftop pad, rotors still spinning, cutting the air with rhythmic precision. The radio on the wall crackled. "This is Medevac 7. We have 5 casualties. 2 critical, 3 stable. First critical is Captain Miguel Santos, 29-year-old male, Marine Force Recon. Single GSW to left thorax. Entry wound approximately 2 centimeters lateral to sternum at 4th intercostal space. No exit wound. BP 70/40 and dropping. Heart rate 140. Oxygen saturation 88%. Suspected hemothorax or cardiac injury. ETA 1 minute. Brennan pointed to different residents, assigning them to specific casualties. Dr. Sunsend. Park, you take the stable GSW to right lower extremity in Bay 3. Chen, you handle the shoulder wound in Bay 4. I'll take Captain Santos. Elena stood near Bay 2, waiting for assignment. Dr. Volkov, Brennan called out without looking at her. You handle the least critical case in Bay 5. Simple through and through GSW to left thigh. Should be straightforward. Understood, Elena said. The doors burst open and gurneys flooded in, pushed by paramedics still wearing flight helmets, their uniforms marked with patches identifying them as Marine Corps medical personnel. The first gurney carried Captain Santos, his face pale beneath an oxygen mask, his uniform cut away to expose the chest wound. Trauma 1, a paramedic shouted, steering Santos toward the bay where Brennan waited. He's been in and out of consciousness, started declining about 2 minutes out. Elena moved to Bay 5 as directed, where a young lance corporal with a leg wound was being transferred from gurney to bed. But as she gloved up, her eyes tracked Santos being wheeled past. Something about the wound pattern triggered recognition. The location, the trajectory, the way his neck veins were distended despite the hypotension. She knew that presentation. In Bay 1, Brennan cut away the rest of Santos's uniform and examined the entry wound. Chest tube tray, he ordered. This is a massive hemothorax. We need to decompress immediately. Elena positioned herself beside her patient, assessing the thigh wound. Clean through and through, no vascular involvement, minimal bleeding. She could handle this in her sleep, but her attention kept drifting to Bay 1, where monitors were alarming. She watched Brennan insert a chest tube. Blood poured out, dark red, venous, a lot of it. But Santos's pressure wasn't improving. Dr. Brennan, Elena called out, her voice cutting through the noise. Not now, Dr. Volkov. I'm managing this. His jugular veins are distended, despite the hypotension. That's Beck's triad. Brennan paused, glancing at Santos's neck. The chest tube is draining. It's a hemothorax. It's also cardiac tamponade, Elena said, moving slightly away from her patient. The GSW trajectory at that location, combined with persistent hypotension despite decompression and JVD, indicates pericardial involvement. He needs a pericardial window or thoracotomy. I'm aware of the differential diagnosis, Brennan said sharply. His tone made it clear the discussion was over. Focus on your patient, doctor. Elena hesitated, her fingers tightening around the forceps she was holding. Every instinct screamed at her to intervene. She'd seen this exact scenario play out in field hospitals. Delayed recognition of cardiac tamponade in penetrating chest trauma. Every second mattered, but she wasn't in a field hospital. She was in a civilian facility with hierarchy and protocol and chain of command, and she was the contractor with the questionable resume who'd been hired to handle routine cases. She forced herself to turn back to the Lance Corporal's leg wound. In Bay 1, Santos's monitor began alarming more urgently. BP dropping, a nurse called out. 60/30. Heart rate 150 and climbing. Brennan increased the IV fluids. Push another liter of LR. Type and cross for 6 units. Get me a portable ultrasound. Santos's eyes fluttered open briefly. Through his oxygen mask, he muttered something incoherent. His gaze drifted across the trauma bay, unfocused, until it landed on Elena's profile 20 feet away. His eyes widened slightly. I know her, he whispered, the words barely audible beneath the mask. The paramedic standing beside his gurney leaned closer. What was that, Captain? That doctor, Santos said, his voice fading. Over there. I know her. From Aleppo. She was there. The chemical attack. She saved us. The paramedic followed Santos's gaze to Elena, who was irrigating the Lance Corporal's wound, her back to them. He frowned, uncertain whether to take the delirious statement seriously. Easy, Captain. You're confused. Just stay with us. But the paramedic was a veteran, too. 10 years as a Navy corpsman before transitioning to flight medicine. And he'd been in Aleppo. Different unit, different sector. But he'd heard the stories. About a surgical team that had worked miracles during that hellish 72-hour period, when the world thought everyone in the city was going to die. He studied Elena more carefully. The posture, the precision, the way she moved with absolute confidence despite working the lowest priority case. Then his eyes caught the edge of her tattoo as she reached for an instrument. Numbers, coordinates. His breath caught. Dr. Brennan, Santos is coding, a nurse shouted. Elena's head snapped up. The monitor showed ventricular tachycardia rapidly deteriorating into ventricular fibrillation. Santos's body convulsed once, then went still. Charging defibrillator, Brennan ordered. Everyone clear. The shock delivered. Santos's body jerked. The monitor showed a brief return to sinus rhythm, then flatlined. Again, 200 joules. Another shock. Nothing. Compressions, Brennan commanded, and a resident began chest compressions while Brennan prepared to intubate. Elena watched from Bay 5, her hands frozen mid-suture. She counted the seconds in her head. 60, 90, 120. Santos's chances were dropping exponentially with every passing moment. He's been down for 3 minutes, the nurse announced. Continue compressions. Push EPI. 4 minutes. Elena's fingers tightened around the needle driver. She could see it so clearly. The pericardial sac filling with blood, compressing the heart, preventing it from filling properly between beats. No amount of chest compressions would fix that. He needed surgical decompression. Now. 5 minutes, the nurse said, her voice starting to waver. Brennan stepped back, his face drawn. He looked at the monitor, at Santos's ashen face, at the team performing increasingly futile resuscitation efforts. Stop compressions, Brennan said quietly. The resident stopped. Everyone turned to Brennan. He's been down for 5.5 minutes with no response to ACLS protocol. At this point, the likelihood of meaningful recovery, even if we achieve ROSC, is minimal. Time of death, 14:51. No. Everyone turned. Elena had stepped away from her patient and was walking toward Bay 1. Her voice was steady, absolute. He's not dead yet, she said. And I'm not letting him die because we followed protocol instead of treating the actual pathology. Dr. Volkov, Brennan began. Elena cut him off. That's cardiac tamponade from a ventricular injury. He needs emergency pericardiotomy. Give me 3 minutes. Brennan stared at her. He's been in cardiac arrest for nearly 6 minutes. Elena met his eyes. Then we don't have time to argue. Step aside or assist me. Your choice. The trauma bay went absolutely silent. Every eye fixed on Elena as she stood beside Santos's gurney, her amber eyes locked on Brennan's face. The monitors continued their flat, monotonous alarm. 6 minutes of cardiac arrest. The threshold where brain damage became inevitable was rapidly approaching. "Dr. Volkov," Brennan said slowly, "you're asking me to authorize an emergency thoracotomy on a patient who's already clinically dead. I'm telling you he has a surgically correctable problem that's killing him. If you won't do it, I will." "On whose authority?" "On the authority of 6 years performing combat trauma surgery in conditions where waiting for authorization meant body bags." The trauma bay remained frozen. Nurses exchanged glances. Residents stood paralyzed, uncertain whether they were witnessing heroic determination or career-ending insubordination. Brennan stared at her. His jaw worked silently. Then, almost imperceptibly, he stepped aside. "You have 3 minutes," he said. "After that, I'm calling it." Elena didn't waste time acknowledging him. She turned to the scrub nurse. "Thoracotomy tray. Rib spreaders. Pericardial scissors. Vascular clamps. Internal defibrillator paddles. Move." The nurse sprinted to retrieve supplies. "Dr. Park," Elena called out. "You're assisting. Glove up. Now." Park, who'd been standing near Bay 3, immediately moved to the sink and began scrubbing. Jake, the veteran nurse, appeared at Elena's side with a sterile pack already opened. He said nothing, but his eyes conveyed complete understanding. He'd seen field surgeons work under impossible conditions before. He knew what he was looking at. "Betadine," Elena said, pouring the solution across Santos's left chest without waiting for formal sterile prep. There was no time for elegance. She accepted a scalpel from Jake. Number 10 blade. With a single smooth motion, she made an incision from sternum to mid-axillary line, following the 5th intercostal space. Blood welled up immediately. She didn't hesitate. "Electrocautery," she said, and Jake slapped the bovie into her palm. She cauterized bleeding vessels as she went, working with a speed that seemed reckless, but was actually the product of hundreds of repetitions under fire. Park arrived beside her, gloved and gowned, eyes wide. "Rib spreaders," Elena said. Park positioned them. Elena cranked them open, spreading Santos's ribs apart with a sound that made several observers wince. The thoracic cavity opened, revealing the pericardium, which was visibly distended and dark with accumulated blood. "There it is," Elena said. "Pericardium is under tension. That's your tamponade." Brennan moved closer, observing despite himself. Elena lifted the pericardium carefully, avoiding the phrenic nerve, and made a longitudinal incision with scissors. Blood poured out, dark and thick, filling the chest cavity. "Suction," she commanded, and Park immediately began evacuating the blood. As the pericardial sac decompressed, Santos's heart became visible. It was still, motionless. But Elena could see the injury now. A small laceration on the right ventricle, no more than 8 millimeters long, oozing blood with each attempted contraction. 7 minutes down, Brennan said quietly, checking his watch. Elena placed her gloved hand directly on Santos's heart and began manual compression, squeezing in rhythm, forcing blood through the chambers manually. "He's been without perfusion for too long," a resident whispered. "Not helpful," Elena said without looking up. "Park, I need you to hold the pericardium open. Keep it retracted." Park complied, her hands shaking slightly but steady enough. Elena continued compressions with one hand while reaching for a suture with the other. "Pledgeted 30 proline," she said. "Preloaded." Jake handed it to her, the needle already curved and ready. What she did next would be discussed in surgical conferences for months. While maintaining cardiac compressions with her left hand, she used her right to place a pledgeted suture through the ventricular wall, cinching it tight to close the laceration. One-handed, in a heart that wasn't beating. "Impossible," someone whispered from the observation area above. Elena placed a second suture, then a third, each one perfectly positioned despite the awkward angle and the continued compression. Her hands moved independently, each with its own task, synchronized like a pianist playing different melodies with each hand. Brennan leaned closer, transfixed. "How are you doing that?" "Practice," Elena said simply. She tied off the final suture. The laceration was closed, but the heart remained still. "Internal paddles," she said. Jake handed them over. Elena positioned them on either side of Santos's heart. 20 joules. The shock delivered. Santos's heart contracted once, weakly, then stopped. 30 joules. Another shock. A flutter of movement. Then nothing. Elena resumed manual compression, squeezing rhythmically, forcing blood through the coronary arteries, buying time for the cardiac cells to recover from their oxygen debt. 8 minutes, Brennan said. His voice carried a note of resignation. Elena, even if we get him back now, the brain damage will be catastrophic. Elena didn't respond. She just kept compressing. 30 compressions. 40. 50. Dr. Park watched her face. There was no desperation there, no panic, just absolute focus, as if she'd decided Santos was going to live, and reality would simply have to adjust to accommodate that decision. He said he knew you, Park said suddenly. When he came in, he said he knew you from Aleppo. Elena's hands paused for a fraction of a second, then resumed compression. What happened in Aleppo, Dr. Volkov? Park asked softly. Before Elena could answer, the monitor beeped. Once, then again, then a regular rhythm. Everyone froze. We have sinus rhythm, the anesthesiologist called out. Rate 60, pressure rising, 70 over 40, 80 over 50. The monitor showed organized electrical activity. Santos's heart contracted on its own. Once, twice, building strength with each beat. Oxygen saturation climbing, the nurse added. 72%. 78. 84. Elena kept her hand on Santos's heart, feeling it beat against her palm. Strong, regular, alive. 9 minutes in cardiac arrest, Brennan said, his voice barely above a whisper. You brought him back from 9 minutes down. Elena removed her hand carefully, checking the suture line. No bleeding. The repair was holding. We need to close and get him to ICU, she said. He'll need hypothermia protocol to minimize neurological damage. Core temperature reduction to 33 degrees Celsius for 24 hours. Then gradual rewarming. Brennan nodded slowly, still processing what he'd just witnessed. Yes, of course. Elena began placing chest tubes to drain residual blood. Park assisted, moving now with complete confidence in Elena's judgment. Dr. Volkov, Brennan said as she worked. Yes? Who are you? Really. Elena secured the final chest tube and reached for suture to close the thoracotomy incision. She was quiet for a long moment. The trauma bay had emptied except for the core team. The other casualties had been stabilized and moved to their respective ORs or recovery areas. Finally, she looked up at Brennan. Colonel Elena Volkov, she said quietly. United States Army Medical Corps. 6 years attached to Joint Special Operations Command. Combat surgeon for Delta Force and SEAL Team 6. Syria, Iraq, Afghanistan. 347 trauma surgeries performed under fire. 23 surgeries in 11 hours during the Aleppo chemical attack in 2020. The room went completely silent. Those coordinates on your arm, Park said. 36 degrees, 12 minutes, 23 seconds north. 37 degrees, 9 minutes, 47 seconds east. Elena glanced down at the numbers partially visible beneath her sleeve. Aleppo, where I learned that giving up is never an option. Brennan took a step backward, his face pale. You're classified. Was classified. I left the service 18 months ago. Why? Elena focused on placing interrupted sutures to close Santos's chest. Because I got tired of making choices about who lives and who dies based on mission priority instead of medical need. Because I lost 3 soldiers in that chemical attack because I had to choose who to treat first. Because I wanted to practice medicine without carrying a sidearm. She tied off the final suture and stepped back. Santos's vitals continued to strengthen. His oxygen saturation hit 96%. His blood pressure stabilized at 110/70. But you came back, Park said. To this. Why? Because the skills don't go away, Elena said softly. And neither does the responsibility to use them. The word spread through Walter Reed like wildfire. By the time Santos was stabilized and transported to the ICU, every resident, attending physician and nurse on duty, knew that the temporary contractor with the gap in her resume, had just performed an emergency resuscitative thoracotomy and brought back a patient who'd been clinically dead for 9 minutes. Elena stripped off her blood-soaked gown in the scrub room, methodically washing her hands and forearms, while Dr. Park stood beside her, still processing everything she'd witnessed. "How many times have you done that?" Park asked quietly. "Emergency thoracotomy in the field?" 43 times, Elena said without hesitation. 31 survived to evacuation. 26 made it home. And the ones who didn't? Elena's hands stilled briefly under the running water, then resumed scrubbing. "The ones who didn't taught me that speed matters, but precision matters more. And that 9 minutes isn't dead. It's just the beginning of the fight." Before Park could respond, the scrub room door opened, and Brennan entered. His face was unreadable, somewhere between awe and anger. "Dr. Volkov, my office." "Now." Elena dried her hands slowly. "Am I being terminated? That depends on how the next conversation goes." They walked in silence through the corridors. Staff members stopped what they were doing to stare. Some with admiration, others with curiosity, a few with suspicion. Elena kept her eyes forward, her posture perfect, her expression neutral. Brennan's office was on the 4th floor, overlooking the hospital's main entrance. It was immaculate. Diplomas and certifications lined one wall. Medical journals were stacked with precise organization on his desk. Everything about the space screamed order and control. "Sit," Brennan said, closing the door behind them. Elena remained standing. "With respect, doctor, I prefer to stand." Brennan studied her for a long moment, then moved behind his desk. He didn't sit either. He opened a file and spread several pages across the surface. Elena recognized them immediately. Her service record, or at least the declassified portions of it. "I made some calls," Brennan said, "to people I know at the Pentagon. Colonels don't just walk away from Joint Special Operations Command with nothing but a handshake and a thank you. There are always reasons. I told you my reasons. You told me you were tired of making impossible choices, that you lost 3 soldiers in Aleppo, but you didn't tell me the whole story." Elena's jaw tightened. "Because the whole story is classified. Not anymore." Brennan tapped one of the pages. "I have a contact at JSOC who owes me a favor. He pulled your after-action reports from the Aleppo incident. Redacted, but enough details came through. He shouldn't have done that. Maybe not. But I needed to know who I'm employing. And what I found is that you performed 23 consecutive surgeries over 11 hours during a chemical weapons attack, saved 41 lives, military and civilian. Children, Elena. You saved 17 children that night." Elena said nothing. Her hands clasped behind her back, knuckles white. "The report also says you lost 3 soldiers," Brennan continued. "Staff Sergeant Marcus Williams, Corporal Daniel Chen, Private First Class James Rodriguez, all special operations. All killed because you were working on civilians when they were brought in with critical injuries. Is there a question in there, Dr. Brennan?" "Yes. Why did you prioritize civilians over your own soldiers?" Elena's voice was quiet but steady. "Because the civilians were children, ages 4 to 12, exposed to sarin gas, seizing, dying. The soldiers were combat trained. They knew the risks. The children didn't choose to be there, but you were attached to those soldiers. They were your responsibility. Everyone in that hospital was my responsibility. I made the choice I had to make, and it destroyed you." Elena's eyes flashed. "It taught me that war isn't about making the right choice. It's about living with the consequences of impossible ones." Brennan was quiet for a moment. Then he closed the file. Those 3 soldiers. Elena. They disobeyed direct orders to stay at the perimeter. They went into the hot zone against protocol, trying to evacuate more civilians. The after-action report states clearly that their deaths were not your fault. The investigating officer recommended you for a Silver Star for your actions that night. I turned it down. Why? Because medals don't bring people back. Brennan leaned forward, his hands flat on the desk. You're carrying guilt that isn't yours to carry. Those men made their own choices. You saved 41 lives that night. 17 children. Most surgeons don't save that many lives in a year. I know what I did, Elena said, her voice hardening. And I know what I didn't do. I can recite every detail of those 11 hours. Every surgical decision. Every triage call. Every face of every child I saved and every soldier I lost. So don't tell me what I should or shouldn't feel guilty about. The office fell silent. Outside, the sun was beginning to set, casting long shadows across the room. Brennan straightened. I'm offering you a permanent position. Senior trauma surgeon. Full privileges. Autonomy in your surgical decisions. Salary commensurate with your experience and expertise. Elena blinked. What? You just performed a procedure that most surgeons wouldn't attempt even with a full team and perfect conditions. You did it in a trauma bay with 9 minutes on the clock and saved a life that everyone else had written off. Walter Reed needs surgeons like you. Not contractors, not temps. Surgeons who understand that protocols are guidelines, not gospel. I left the military to escape this, Elena said. To escape the pressure of life and death decisions every single day. You didn't escape it. You just changed the uniform. Brennan's voice softened slightly. You're never going to be the kind of doctor who handles routine cases and goes home at 5. That's not who you are. So stop pretending and accept what you're actually good at. Elena was quiet. She looked down at her hands. Surgeon's hands. Hands that had held beating hearts and tied off bleeding vessels and sutured wounds while buildings collapsed around her. Brennan was right. She'd never escaped. She'd just convinced herself she could. I have conditions, she said finally. Name them. First, I want to establish a reintegration program for military physicians transitioning to civilian practice. Too many combat surgeons leave the service and can't adapt because civilian medicine doesn't value their expertise. Done. What else? Second, I want to develop trauma protocols that integrate battlefield techniques without unnecessary bureaucratic delays. What I did today shouldn't require authorization debates while patients die. Agreed. And third, Captain Santos. I want oversight of his recovery. Physical and psychological. He's going to need extensive rehab. He's lucky to be alive, Brennan said. Thanks to you. He's not out of the woods yet. 9 minutes in a rest means potential neurological complications. I want to monitor him personally. You'll have full access. Elena nodded slowly. Then I accept. Brennan extended his hand across the desk. Elena stepped forward and shook it. His grip was firm, professional, and for the first time since she'd arrived at Walter Reed, held no trace of condescension. One more thing, Brennan said as she turned to leave. Yes? Why didn't you tell us from the beginning? About your background? Your experience? You could have walked in here with credentials that would have made you the most sought-after trauma surgeon in the country. Elena paused at the door, because I wanted to know if I could still do medicine without the rank, without the uniform, without people looking at me and seeing a war hero instead of a doctor. I needed to prove to myself that the skills mattered more than the story. And do they? Elena glanced back at him. Ask Captain Santos when he wakes up. She walked out, leaving Brennan standing in his office, staring after her with an expression of profound respect. Down in the ICU, Santos lay in a medically induced coma, his chest covered in fresh dressings, his vitals slowly strengthening. The hypothermia protocol was already underway, cooling his core temperature to protect against brain damage. Elena stood at the observation window, watching the monitors. Doctor, Park appeared beside her. You saved him, Park said. We'll see. The next 72 hours will tell us if there's lasting damage. You don't believe in celebrating victories, do you? Elena's reflection in the glass was somber. I believe in waiting for the outcome before calling it a victory. Park studied her profile. You're going to teach me everything you know, aren't you? If you're willing to learn. Park smiled. I am. Starting now. What should I be watching for in his neuro assessments? And just like that, in the quiet glow of the ICU monitors, the real work began. 3 months later, Walter Reed National Military Medical Center looked different through Elena's eyes. Not physically, the buildings and corridors remained the same, but the way people moved through them had changed. Residents walked with more confidence. Trauma protocols had been streamlined, and the newly established Volkov Combat Civilian Trauma Integration Unit occupied an entire wing on the 3rd floor. Elena stood in the unit's main conference room, reviewing architectural plans for the expanded surgical simulation lab. Dr. Park was beside her, now officially her surgical fellow, pointing out modifications to the trauma bay layout. "If we move the ultrasound station here," Park said, tapping the blueprint, "we shave off 12 seconds in diagnosis time for abdominal trauma." "Good catch. Make the change." The door opened and Brennan entered, carrying a thick folder. He'd changed too over these months. Less rigid. More willing to challenge conventional wisdom when evidence supported it. Working with Elena had forced him to confront the limitations of protocol-driven medicine. "Elena, we need to talk," he said, his tone serious. She looked up from the plans. "Something wrong?" "That depends on your definition." He set the folder on the table and opened it. "This arrived by military courier an hour ago. It's from General James Cordell, SOCOM commander." Elena's expression didn't change, but Park noticed her shoulders stiffen almost imperceptibly. "What does he want?" Elena asked. "To thank you, apparently." Brennan pulled out a letter bearing official Department of Defense letterhead. "He's also requesting a meeting. Tomorrow, if you're available." "I'm not interested in reunions with former command." Brennan slid another document across the table. "You might want to read this first. It's a declassified investigation report about the Aleppo incident." Elena's hand froze halfway to the paper. "That's still classified." "Not anymore. The general personally pushed for declassification. He wanted you to see it." Elena picked up the report slowly, her eyes scanning the dense text. Park watched her face carefully as she read. For a long moment, there was nothing. Then Elena's jaw clenched. Her breathing changed. When she finally looked up, her eyes were bright with something Park had never seen there before. Tears. "What does it say?" Park asked gently. Elena's voice was barely a whisper. "The 3 soldiers I lost. Williams, Chen, Rodriguez. They weren't following mission parameters when they entered the hot zone. They received direct orders from their team leader to hold position at the perimeter. They disobeyed those orders deliberately. We already knew that," Brennan said carefully. "No." Elena shook her head. "You knew they disobeyed orders. But I didn't know why." She pointed to a paragraph in the report. "They intercepted radio chatter about a group of children trapped in a collapsed school 2 blocks from the hospital. The team leader ordered them to wait for chemical clearance before attempting rescue. They went anyway. Saved 4 children. Got exposed to residual sarin in the process. That's why they were critical when they reached me." She sat down heavily in the nearest chair. "They were dying because they saved 4 more children. Not because I chose wrong. They were already dying when they arrived." Brennan pulled out another page. "The investigating officer's conclusion states explicitly that your triage decisions were medically and ethically sound. You could not have saved them, Elena. Their exposure was too severe. Even immediate treatment wouldn't have changed the outcome." Park moved to Elena's side, placing a hand on her shoulder. "You've been carrying guilt for 4 years for something that was never your fault." Elena wiped her eyes roughly. 4 years of believing I sacrificed soldiers to save civilians. 4 years of thinking I chose wrong." "You didn't choose wrong," Brennan said firmly. "You made the only choice you could with the information you had, and 17 children are alive because of it, along with 24 adults, and those 3 soldiers' final act of heroism. That's 44 lives in total, Elena. Not 41. The room fell quiet. Outside, the sun filtered through the windows, casting warm light across the conference table. "General Cordell wants to meet with you," Brennan said after a moment. "He's here to present you with the Silver Star you refused 4 years ago, along with an official apology from the Department of Defense for not providing this information sooner." Elena looked at the report again, her fingers tracing the words. "An apology doesn't change what I lived with." "No, but maybe it lets you stop living with it." Elena was quiet for a long time. Then she nodded. "Tell the general I'll meet with him. Tomorrow at 1400 hours. Here, not at the Pentagon." Brennan smiled slightly. "I'll arrange it." After he left, Park sat down beside Elena. How do you feel? Elena stared at the documents spread across the table. Lighter, she said finally. Like I've been carrying a weight I didn't know I could put down. What will you do now? The same thing I've been doing. Save lives, train surgeons, build something that matters. Park smiled. You've already built something that matters. 89 trauma surgeries in 3 months, 96% survival rate. 12 veterans successfully transitioned into civilian practice through your program. You're changing how trauma medicine is taught across the country. Elena allowed herself a small smile. We're changing it. You, me, Brennan, everyone on the team. Speaking of the team, Park said, changing the subject, I got the approval for the fellowship expansion. We can bring in 6 more doctors next quarter. Good. Make sure at least 3 have military backgrounds. Already on it. They worked in comfortable silence for a while, reviewing protocols and updating training schedules. Around them, Walter Reed hummed with the organized chaos of a major medical center. Somewhere down the hall, a code blue was called. Residents ran past the conference room window. The work never stopped. At 6:45 that evening, Elena made her way to the ICU. It had become her routine over the past 3 months. Check on Captain Santos's progress. Review his charts. Speak with his care team. But tonight was different. Tonight, Santos was sitting up in bed, awake and alert, working through physical therapy exercises with his occupational therapist. When he saw Elena approaching, his face broke into a genuine smile. Colonel, he said, his voice still slightly hoarse from weeks of intubation and recovery. Captain, Elena replied, moving to his bedside. How are you feeling? Like I got shot in the chest and died for 9 minutes, he said with dark humor. But alive, so I'm not complaining. The therapist excused herself, giving them privacy. Santos studied Elena's face. I remember you, he said quietly. Not just from here, from Aleppo. You were there during the chemical attack. You operated on my team leader, Sergeant Hayes. Saved his life. Elena nodded slowly. I remember Hayes. Severe shrapnel wounds. Bilateral pneumothorax. He came home because of you. Got to meet his daughter, who was born while he was deployed. She's 4 now. Elena felt something shift in her chest. I'm glad. I also remember Williams, Chen, and Rodriguez, Santos continued. They were legends in Force Recon. What they did that day, saving those kids, it mattered. We all knew the risks. We all made our choices. Elena's eyes glistened. I thought I failed them. You didn't fail anyone, Colonel. You saved everyone you could. That's all any of us can do. They sat in silence for a moment. 2 soldiers who'd seen the worst of war, and somehow found their way back to something resembling peace. Doctor, Brennan told me you're being offered a position, Santos said. National Trauma Training Initiative, working with the Department of Defense and FEMA. I haven't decided yet. You should take it. What you do, how you teach people to think under pressure, it saves lives. Not just in hospitals. Everywhere. Elena smiled. I'll think about it. One more thing, Santos said, reaching for his phone on the bedside table. My wife is pregnant. Baby's due in 2 months. We'd like you to be the godmother. Elena's breath caught. Miguel, You gave me my life back, he said simply. Let me share it with you. Elena looked at this young Marine who'd survived death because she refused to accept it, who carried no bitterness, only gratitude. I'd be honored, she said softly. 6 months after Elena Volkov walked into Walter Reed as a temporary contractor with a questionable resume, she stood at the podium in the hospital's main auditorium, facing an audience of 200 physicians, residents, and military medical personnel from across the country. The Volkov Combat Civilian Trauma Integration Program had become a model studied by medical institutions nationwide. In 6 months, the program had achieved a 23% improvement in trauma survival rates at Walter Reed. 47 military personnel had been saved using techniques Elena pioneered. 62 veteran physicians had successfully transitioned to civilian practice through her mentorship initiative. But today wasn't about statistics. Today was about changing how medicine thought about trauma itself. The traditional approach to trauma care, Elena said, her voice carrying clearly through the auditorium, is built on protocols developed in controlled environments, clean hospitals, adequate staffing, reliable supply chains. But trauma doesn't happen in controlled environments. It happens in chaos, in resource scarcity, in moments where the textbook answer isn't available. She clicked to the next slide, showing a comparison of survival rates between conventional trauma protocols and integrated military-civilian approaches. What combat medicine teaches us isn't that protocols are wrong. It's that protocols are starting points, not endpoints. When a patient is dying, the question isn't what does the protocol say. The question is what does this patient need right now? In the audience, Brennan sat beside General Cordell, who'd flown in specifically for this presentation. The general leaned over and whispered, "She's exactly what military medicine needs. When are you releasing her to us?" "Never, if I can help it," Brennan replied with a slight smile. On stage, Elena continued, "Over the next 6 months, this program will expand to include simulation training for high-stress decision-making, mandatory rotations for trauma surgeons in both military and civilian settings, and a national database of combat-tested techniques available to any hospital in the country." A hand raised in the audience. Dr. Marcus Chen, the resident who'd once dismissed Elena as a burnout, now sat in the front row taking notes. "Dr. Volkov, how do you teach surgeons to make life-and-death decisions under pressure without the benefit of combat experience?" "You create the pressure," Elena said. "Our simulation lab doesn't just replicate injuries, it replicates the chaos. Limited light, malfunctioning equipment, multiple casualties arriving simultaneously. You learn to make decisions not despite the chaos, but within it." Another hand. Dr. Amanda Foster. "What about the psychological toll? Combat surgeons have PTSD rates significantly higher than civilian physicians, which is why psychological support is integrated into every aspect of this program," Elena replied. "We don't wait for surgeons to break. We build resilience from the start. Mandatory peer counseling, structured decompression after high-stress cases. And most importantly, we create a culture where asking for help is seen as strength, not weakness." The presentation continued for another 40 minutes. When it concluded, the applause was sustained and genuine. Elena stepped down from the podium and was immediately surrounded by physicians wanting to discuss implementation in their own institutions. General Cordell worked his way through the crowd to reach her. "Colonel Volkov," he said, extending his hand. Elena shook it firmly. "General, thank you for coming. I wouldn't have missed it." He gestured to a quieter corner of the auditorium. "Do you have a moment?" They moved away from the crowd. Cordell pulled an envelope from his jacket. "This is a formal offer from the Department of Defense, FEMA, and the Department of Veterans Affairs. They want you to lead a national trauma medicine task force, 2-year contract, full funding. Your mandate would be to develop and implement integrated trauma protocols across 500 hospitals and train 2,000 physicians." Elena took the envelope but didn't open it. "That's a significant commitment. It's a significant problem. Civilian hospitals are overwhelmed. Military medical facilities are understaffed. And veterans with medical training are leaving the service with nowhere to apply their expertise. You've proven it doesn't have to be that way. What about my work here? Walter Reed would be your headquarters. Dr. Brennan has already agreed to provide whatever resources you need. You wouldn't be leaving. You'd be expanding." Elena looked across the auditorium to where Dr. Park was demonstrating a surgical technique to a group of residents. 6 months ago, Park had been a skeptical senior resident. Now she was teaching others with the same confidence Elena had shown in that first emergency thoracotomy. "Can I think about it?" Elena asked. "Take your time. But not too much time. People are dying while we debate how to save them." He walked away, leaving Elena holding the envelope. She moved to the auditorium's large windows overlooking the hospital grounds. Outside, an ambulance was pulling into the emergency bay. Another patient, another crisis, another opportunity to make a difference. Her phone buzzed. A text message from Santos. "Sophia Grace Santos, born at 8:47 this morning, 8 pounds, 6 ounces. Mother and daughter doing great. Can't wait for you to meet your goddaughter." Elena smiled, feeling warmth spread through her chest. Life continuing. Families growing. Futures built on second chances. Dr. Park appeared at her side. So, are you taking it? The National Task Force position? How did you know about that already? Brennan told me. He wants my opinion on whether we can manage if you're traveling constantly. And what's your opinion? That you'll figure it out. You always do. Park paused. Also, I think you should take it. What you've built here, it's too important to stay contained in one hospital. Elena looked at the envelope in her hand. When I came here 6 months ago, I was running from something. From the weight of impossible decisions. From the guilt of choices I thought were wrong. And now I know those choices were exactly what they needed to be, and that running from your past doesn't change it. But using it to build something better, that's redemption. Park smiled. So that's a yes. That's a yes. They stood together, watching the controlled chaos of the hospital below. Doctors rushing between departments. Nurses coordinating care. Patients being wheeled to surgery. The endless cycle of crisis and healing. Remember when Dr. Brennan asked about my ridiculous tattoo? Elena said quietly, touching her forearm where the coordinates were visible. The coordinates for Aleppo. I remember. He thought they were a fashion statement, but every number represents a life I fought to save. 36 degrees, 12 minutes, 23 seconds north. 37 degrees, 9 minutes, 47 seconds east. The place where I learned that excellence isn't about following protocols. It's about knowing when to break them. Park studied the numbers. Are you going to add more coordinates? For this place? Elena shook her head. This place doesn't need coordinates. It needs action. Her pager went off. Trauma alert. Multiple casualties from explosion at embassy. All senior surgical staff to trauma bay. Elena was already moving before the announcement finished echoing through the corridors. Park fell into step beside her. They moved with practiced efficiency, navigating through hallways that had become as familiar as any forward operating base. In the trauma bay, the team was assembling. Nurses prepping multiple stations. Residents reviewing injury patterns. Anesthesiologists checking equipment. Everyone knew their role. Everyone understood the stakes. Brennan was already gowned and gloved. 3 critical casualties inbound, he announced. Elena, you take Trauma 1. Park, Trauma 2. Chen, Trauma 3. Let's move. The doors burst open and gurneys flooded in. Blood, chaos, shouting. The familiar symphony of emergency medicine. Elena assessed her patient in seconds. Male, early 30s, penetrating shrapnel wounds to chest and abdomen. Hypotensive, tachycardic, altered mental status. Get me a trauma panel, chest x-ray, and 4 units of O-negative, Elena called out. Her hands were already moving, cutting away clothing, identifying wounds, prioritizing interventions. This was what she was made for. Not the quiet routine she'd tried to create, not the escape from responsibility, but this, the edge between life and death, the place where skills met will and refused to accept defeat. BP dropping, a nurse called out. 70/40. Prepping for emergency laparotomy, Elena responded without hesitation. Get me an OR. Across the bay, Park was working with the same focused intensity Elena had taught her. Chen was calling out orders with confidence he hadn't possessed 6 months ago. The entire team moved like a single organism, each part supporting the others. This was the legacy Elena was building. Not just saved lives, though there would be many, but a generation of physicians who understood that medicine at its best wasn't about caution and protocol. It was about courage and commitment and the absolute refusal to give up when everyone else said it was hopeless. An hour later, Elena's patient was stable and headed to the OR. Park's patient was intubated and responding to treatment. Chen's patient was already in recovery. 3 for 3. Elena stripped off her gloves and stepped into the corridor. Her scrubs were blood-stained. Her hair had fallen partially loose from its tie. She looked exactly like what she was, a surgeon who'd just fought death and won. Jake, the veteran nurse, passed by with a supply cart. He caught her eye and nodded once. Recognition, respect, understanding. Elena nodded back. Then she pulled out her phone and opened the text message from Santos. Looked at the photo of Sophia Grace tiny and perfect, wrapped in hospital blankets. Some people called what Elena did heroic. Others called it extraordinary. But Elena knew the truth. It was just purpose, pure and simple. The coordinates tattooed on her arm would always remind her of where she'd been. But the lives she saved every day reminded her of why she was here. And that was exactly where she was meant to be. The journey wasn't over. It was just beginning. New challenges waited, new patients, new opportunities to teach others that excellence comes from embracing who you are and using every skill, every experience, every hard-won lesson to make the world slightly better than you found it. Elena Volkov had come to Walter Reed as a contractor with a gap in her resume. She was leaving eventually as the architect of a program that would change trauma medicine across the nation. But right now, in this moment, there was just the next patient, the next crisis, the next chance to prove that 9 minutes isn't death. It's just the beginning of the fight, and Elena Volkov never stopped fighting.